Hey, just coming to do a short video real quick. If you watched the last one, I did talk about going ahead and doing like an educational one from the nursing standpoint, in my nursing background, just to hopefully help prevent anything from happening to anybody, or answering some of those questions that you may have not received an answer when you went in to see your surgeon. But just a couple of questions, like I said, I was getting in my inbox, that just concerned me a little bit. And again, that nursing side of me, it just kicked in, and I just want to help educate everybody. So if you're getting ready to have surgery, your doctor normally gives you a rundown on certain medications and things they want you to stop taking before surgery. Take it serious. Like it can really help save your life. It's just not something that they're kind of recommending or this. Really do it. As far as like caffeine, if they tell you any aspirin-based medication, hold on that. Any NSAIDs, which are non-steroid anti-inflammatory medications like ibuprofen, Advil, they fall underneath that category. One big thing after surgery, you have to get up and you have to move. You may be in pain, but get up. Make yourself get up, make yourself walk around. You got to keep moving. Maybe one of the reasons why I had some swelling, I didn't have a whole lot. Right after, when I got home, I was a little loopy from my medication. I got my butt up and I started moving around because I knew what could happen if I didn't do that. Another thing I started doing is wearing compression socks. So I don't know if any of you are familiar with what compression socks, compression hoses are. Here's a pair, just I pick up just a fun color, and I wear these to work sometimes. I very seldom work the floor, but if I'm gonna have to work the floor, since I don't do it often, and this helps just keep the blood flowing and circulation, these. If you've seen any elderly people walking by with those kind of tight hoses that come up to the knee or above them, those. They have them at Walmart. You can pick these up off Amazon. They're called compression socks. Any scrub store that sells scrubs, uniforms, they'll have those. Really highly recommended after surgery, because when you are laying down, that's going to keep those lower extremities compressed. That's going to keep that blood flowing and circulating and help prevent blood clots. So that's one of the main reasons you want to get up and move around after surgery. So it's mostly elderly people that are at higher risk for potentially catching pneumonia after surgery, but that's also an option if you don't get up and you don't move around. And just with COVID going on, I know the numbers are going down, thank God, but still you just can't be too careful. So anytime you have any invasive procedure done or anything, it takes a hit at your immune system. So your immune system is down already. So if you're just laying down and say you develop a cough and you're laying down flat on your back all the time, you're not deep breathing, especially if you start getting some discomfort in the chest, that's going to put you at higher risk for catching pneumonia. You get up, if you develop a cough, you cough deep, breathe deep, do some breathing exercise. You can look them up online. If you start to develop any gunk, soreness in the throat, congestion, reach out to your doctor right away, especially right after having surgery. And each again, doctor practice differently. But one thing you could ask them about after surgery, any aspirin-based medication, because aspirin-based medication, NSAIDs, ibuprofen, Advil, those can thin out the blood. Also, alcohol. Right after you have surgery, stay away from alcohol. You ever heard the saying, don't get drunk and get a tattoo because you're going to bleed? That's why. So same thing after surgery, and you're already, if you get whatever body part done, you're draining and you're bleeding. So you don't want to drink a lot of alcohol. That's going to thin it out. It's going to be flowing out so fast. So be careful with that. Also, be honest with your surgeon about your health. If you have health conditions, don't be afraid like, oh, you just may not be able to have the surgery because of this. Be honest with them. Be honest with them with whatever's going on with you, whatever issues you have. A lot of times they may send you in, you get a medical clearance, but that's okay. Protect yourself first. You only get one you. So just always remember that. Pain medication. So it's important to take your pain medication. So I took pain medication for the first day. The second day, I think I took 2 doses, and then I cut down to 1. I think out of my whole 30 oxycodone they sent me home with, I took 6. That was it. But I was up and moving around. It may be painful, but you need to just get up and move around. The pain medication. So if you're in pain, you can't properly heal. So that also can prolong your healing process. So also make sure to take your pain medication when you need it. When you don't take it. Now, any pain medication can cause constipation. It dries your system out. So what I did is I had stool softeners on hand, which luckily I didn't need them. Make sure to drink plenty of water, cold drinks, Miralax, Colace over-the-counter stool softeners. So also a side effect of pain medication. And also make sure you eat when you take your pain medication. Even if they send you antibiotics, make sure to put something on your stomach, because if not, it can really make you feel icky. It can cause nausea, vomiting. So make sure to eat, drink plenty of fluids, have some stool softeners on hand if you need it. Fluid. Really important to push fluid, and it seems like kind of weird, like after you have surgery, you're already so swollen, you feel like you got so much fluid on you. Why you want to keep pushing this fluid in your system? You need it to flush your system out. And make sure you're pushing good fluids, water, or push things with electrolytes in them, like Gatorades, different things like that. Stay away from the soda. Stay away from the soda right after. So also be careful, like with your pain medication. Some people typically prefer, I call them either Tylenol people or ibuprofen people. I'm an ibuprofen type girl. I don't take a lot of Tylenol. But if you like taking over-the-counter Tylenol, that's kind of your go-to if you have a headache or general discomfort. And say after your surgery, you're taking your pain medication, be careful. Look it up. If you're taking hydrocodone, that has Tylenol in it. So if it has like 5/325 or 10/325, that 325 is Tylenol that's in 1 pill. So the daily max recommended dose for Tylenol is 4,000 milligrams a day. Depending on your health, it could vary. So check with your primary care doctor. Hey, what is a daily max dose of Tylenol I can take? So when you're taking your pain medication, also be careful about adding in over-the-counter medication like Tylenol, because that medication may have Tylenol in it. So you have to be careful with that. With your incisions, you got to let them breathe a little bit so they heal. So you always want to keep an eye out. Is, of course, naturally there's going to be some redness around your incision, but is it bright red? Is it spreading out? Is there like a rash around it? Is there weird colored drainage? You may have some red drainage that may turn to a light pink. Is your drainage yellow? Is it green? Is it brown? Is there an odor? Contact your doctor. Contact your doctor. Even if you're not sure, take a picture of it and then monitor it every day. Take a picture of it. Have somebody check the back ones. If you got like a Lipo 360, I would stand in the mirror and I would look at mine in the back. And then I would check the ones in the front. So you don't want to just, if you notice anything, don't ignore it. Reach out to your surgeon, ask them, hey, should it look like this? Should it look like that? I'm big on pictures. Take pictures of it. Keep a trail of it. It looks like this. It was this color drainage. It had this much drainage coming out. And naturally, you're going to have some drainage right after. But it should be blood tinged. When it gets towards the end, maybe like a light brown color. But if it's a dark brown, green, yellow, something odd. And also pay attention to your pain. Where are you having pain at? You having pain at that incision site? Is it getting worse and the other ones are getting better? Never hurts to reach out and to let them know, like, hey, this is going on. Not quite sure if this is normal. Also, too, make sure when you sleep, I elevate my legs. I prop them up on a pillow. Also to help with circulation and everything. So pay attention to your body, your lower extremities. Are you getting a pain in your calf? Is there some bright redness? Is it swollen? Is it hard? If so, you don't massage it out. Not saying at all this is what it is, but it could be signs of a DVT, deep vein thrombosis, which is a blood clot. So if you notice anything like that after surgery or just anytime, reach out to your surgeon. Hey, I noticed this, and that. Don't ever ignore anything. Like I said, you only get one use, so take the best care of yourself. I really hope this video helped answer some questions, and if y'all have any other questions, like I said, I'll be more than happy to help or just express my knowledge about it all. Don't follow what I recommend. You know, what I say works for me, and I'm just giving you some general nursing knowledge. You can all research everything that I just, kind of advise you guys of or recommend it. But when in doubt, always reach out to your surgeon just to make sure you're healthy and you're safe. All right, bye guys.